as well. There are state and local governments in one area that continue to be under enormous and unprecedented strain. According to the Department of Labor, state and local governments lost, I think, just in September alone, $180,000, 180,000. And without some additional federal support, many more jobs are going to be lost. This means that fewer frontline workers like firefighters, like EMS workers, police, as the pandemic continues to sweep through our communities, fewer teachers, fewer bus drivers, fewer janitors in the school nurses, as we try to open safely. In a recent report, CBO confirmed what former governors like Senator Hassan and myself already know from experience, and that is that state and local government aid is one of the most effective means of economic stimulus. Dr. Schwegel, let me just ask, if I could, for you, maybe the first question, could you tell us why aid to state and local governments has such a multiplier effect, and discuss the importance of these governments for economic recovery, please? Dr. Schwegel.
Yes, sir, Senator Carper. So our analysis of the assistance for state and local governments enacted so far, especially in the CARES program, found that those monies, by and large, were spent immediately. You know, not every penny, but by and large, they were spent quickly, and so at a rapid and high, large impact. You know, additionally, the money given to state and local governments headed off or reduced the tax increases and other spending cuts that state and local governments would have had to do. So it had an important impact in sustaining demand in that way as well.
All right, thanks so much. I want to turn to the Comptroller General, talk a little bit more about improper payments, something that he is, his folks have been on forever, all over for as long as I can. You have to on the Homeland Security Governmental Affairs Office, but General Dodaro, and I think in fiscal year 2019, agencies across the government made an estimated $175 billion in improper payments, up from about $151 billion in fiscal year 2018. It wasn't that long ago that number was under $100 billion. It wasn't that long ago that number was actually under $75 billion. And today we're talking about $175 billion in improper payments. And further, as part of the CARES Act, the Treasury Department, as you know, issued over $1 billion worth of checks, $1,200 checks to deceased persons. One of them, as I recall, being your mom, your late mother. Simply put, given our current fiscal condition, we're in no position to continue issuing these kinds of errant payments. Earlier this year, legislation that co-authored with Senator Cassidy's colleague from Louisiana, John Neely Stacy, and also with a hand from Rand Paul, co-authored legislation, comprehensive update to, no, I'm getting ahead of myself. Earlier this year, that's more recently, but earlier this year, something called the Payments Integrity Information Act was signed into law. It's a comprehensive update to improper payments law, which will provide agencies with the tools that they need to curb improper payments. Further, the Stopping Improper Payments to Deceased People has passed, that's a separate piece of legislation that's passed the Senate and now pending in the House. That's the one co-sponsored by Senator Kennedy, co-sponsored by Senator Paul over in the House now. And this bill would more widely share the death data available at the Social Security Administration to agencies to help them prevent payments to deceased people. General Dodaro, what actions do the executive branch and Congress need to take in the immediate term to address this particular issue? And that is in part sending payments to deceased persons.
Well, first, Senator Carper, I think that the executive branch needs to effectively implement the Payment Integrity Information Act of 2019 that you alluded to. This would require a government-wide estimate. I'm concerned that the $175 billion is an understatement, because there are several programs like temporary assistance for needy families where there are no estimates made at all. Also, it would require more rigor in doing risk assessments, because there are some programs that, because of their risk assessment, they don't make estimates either. And I think that might not be appropriate. And also improve the estimates, which will allow for these areas to be able to detect what some of the root causes are of the problem so that they can be addressed. One of the reasons that this is growing so fast is because the two largest areas of improper payments are in Medicaid and Medicare. And actually the jump between 150 and 175 billion in the past year or so has been largely due to Medicaid for the first time since the Patient Protection Act of looking at eligibility, beneficiary determinations, and provider screening to make sure everybody's properly there. And so that's why I'm very concerned, because those are two of the fastest growing programs in the federal government. We need to get on top of that. There's some recommendations we made. There could be some additional prior authorizations in Medicare that would make sure that the payments are appropriate before they're being made. That this is demonstrated to be effective and to not harm anybody's care. There should be more timely auditing of the Medicare Advantage program. In Medicaid, the big growth has been in the Medicaid managed care, and that has received virtually little scrutiny. And I think that needs to be more rigorously pursued in that area with the help of state auditors, which I've been trying to work with the Center for Medicaid and Medicare Studies to get them more involved in this process over time. And the legislation that you mentioned to stop payments to deceased people, if we could get Treasury the proper master file, a more complete master file, this can be done very easily, which was done with the stimulus payments. Once they decided they weren't going to go that route anymore, they were given temporary access to this file, and it stopped it right immediately. So those are some of the areas.
Thanks for those kind words. Again, with my recovering treasurer hat on, I'm a long-time believer that things are worth having to pay for.